and welcome back to Your Health Kenya, a space where we get to talk everything matters health. And we have been unpacking this series on reproductive health, particularly for women, just discussing the different conditions and challenges that women face in regards to reproductive health. And I do hope that you've been enjoying this series, getting to hear stories from different women who've gone through these challenges, as well as the health awareness and the education that we've been able to unpack with our resident gynecologist, Dr. Wasuna. And today we continue with a conversation in regards to fibroid, just because it's quite a wide topic, but going a little bit deeper on the different treatment options for fibroids, and that's what we'll be discussing today. Karibu sana daktari.
Thank you very much.
Mm-hmm. All right. So I know in our last conversation when we were talking about fibroids and just unpacking what fibroids are, we did touch a bit on the different treatment options for fibroids. So I think it would be good maybe to begin by just doing a summary of the different treatment options that we have for fibroids.
So basically they'll be divided into two. Mm-hmm. We have medical treatment and then surgical treatment, maybe others. Mm-hmm. So medical treatments include things to just stop you from having symptoms, even though they're there. Mm-hmm. So it can be as simple as painkillers, because the symptom that you don't like is pain. So a doctor has evaluated you. These are not things you decide to do on your own. Mm-hmm. The doctor evaluates you and says, your fibroids are not really big. Mm-hmm. They're not really serious. The only problem is pain, okay, fine, or heavy bleeding. So we can give you medicines to reduce your pain, reduce your bleeding. So we're talking about a couple of thousands per month. Mm-hmm. So it can be that cheap. Mm-hmm. If we're going to shrink fibroids, it'll probably cost about 21,000 shillings, the whole total dose, spread out over 3 months. But as we mentioned, when we are shrinking fibroids, we are preparing for surgery. Okay. It's not a permanent thing. Or it's giving a lady time to think, yes, and giving her some relief. So we're shrinking them, we put you into artificial menopause. Mm-hmm. That treatment costs about 21,000 shillings, spread out. Mm-hmm. 15 to 21,000, thereabouts, okay? Mm-hmm. Moving on to now when we begin talking about surgicals. Anything surgical is going to be pricey. Mm-hmm. So let's talk about minimal access surgery, meaning laparoscopic surgery. Depends on where it's done. I'm probably thinking about 100,000 in the cheaper ones, all the way to 200, 300,000 in the more specialized or expensive hospitals. Mm-hmm. Cheaper would mean government hospitals, if it can be done, maybe 60 to 100, thereabouts. Mm-hmm. When you move out into private hospitals where nothing is subsidized, then the prices will reflect. So we're talking about up to 300, 400, even up to 500,000, because it also depends on the complexity of surgery. If I'm operating for 1 hour, it's different from if I'm operating for 4 hours. So prices would reflect. So there you go. Same thing with open surgery. When we dealt with uterine artery embolization, where we put in tubes and throw in little small balls to go and block the blood supply. Strangely, it might look like less invasive, yes. But whenever there's a benefit like that, the cost goes up. So my take is minimum 500,000. Okay. For things like that. So whenever there's
that's the less invasive treatment option for fibroids.
Yes.
Okay, that doesn't warrant surgery.
It is a form of surgery. It's a procedure. Let's call it. It's a surgical procedure, but it's not an open procedure.
Not an open procedure.
Okay. The other one I talked about, where we use high intensity focused ultrasound to zap them, that is going to be really expensive. That could be as expensive as 800,000 maybe, if you're going to go out to the country to do it.
Okay, and are these treatment options based off on like the number of fibers you have,
yes.
the size?
That's a good question.
What applies?
Yes. Treatment is very individualized. It's based on how many, how big, what are they doing to you, what's your age, where are you in your reproductive spectrum. Okay. So all these things are taken into account, and then we individualize the treatment for you and choose one of the aforementioned methods. It could be the medical ones, drugs, or the surgical ones. And even with surgery, we choose the routes of surgery based on the fibroids, how they're presented. So if there are too many, we will not do laparoscopic, we'll do open. If they're too big, we'll do open. Are we removing the fibroids or removing the uterus? That's dependent on where a woman is in her reproduction. Yes, the age. So all these things are individualized, and a good discussion with a gynecologist, your doctor of choice, would help choose the method there. Yeah. And there's also personal preference. To some degree, we take that into account, but we advise you on what is best for you. We can't choose for you, but we choose with you.
Okay. All right. I think I was going to ask, are there particular recommended options for fibroid treatment, or once again, is it dependent on?
Yes, there's one recommended, it's the best. See your doctor. That one is, that's the point. Because from there, he'll open up the whole box and we choose what's best for you. So there's no one. But the one is, don't treat yourself. Go see your doctor and let him be the one to explain to you why this particular method is better than this one. What are the side effects of this method vis-a-vis that? So for example, surgery, of course, there's downtime, there's pain which we can manage, risk of infection, risk of bleeding, there's going to be a scar. There are all these things. Why are we doing open surgery and not laparoscopic surgery for you? Yet you don't want any scars on yourself. So we have to explain why we must do it this way. Why are we saying you must have your uterus removed? It's better than this one. Not must, but should. There are reasons. Okay. So case in point, supposing you have fibroids and we've looked at the cervix, we've done a pap smear, and she has got a cervical results that are saying she's possibly going to get cancer later. We'll say, okay, just remove the uterus. So there are things we do. As we're working up towards treatment, especially surgery, we want to ensure that she has enough blood levels. So maybe we might transfuse her, we might ask her to get relatives ready to come and donate blood, important things like that. We will check and see how her kidneys are working, how her liver perhaps is working, because all these play in when we're in surgery. There's some patients who have huge uteruses. We want to make sure, is there a clot somewhere hiding? And when we remove the uterus, all of a sudden, or remove the fibroids, the clot now just moves and complicates and goes into the heart, and then you have a patient who can pass out or literally on the table of the operating theatre. So there's so much that goes into surgery. Surgery is not like climbing a bus or climbing a plane. You just get your ticket and run. We want you to be admitted sometimes a day before, so that we observe, we do a workup as we prepare. So good preparation, good surgery.
Okay. And what does the recovery or healing phase look like for each of those treatment options?
Okay, so of course, the less invasive, the less challenging. Okay. The more invasive, the more challenging. But even so, doctors are what their salt are up to the challenge. So we're talking about pain. We can manage that. We've got good painkillers to keep you, literally, even if it was a morning operation, by evening, you can be walking. Okay. Aware that you've been operated on, but not in any excruciating pain. Okay, that's one. Supposing you had bled during the surgery, there might be transfusions. A woman will be on antibiotics to reduce the risk of surgery. If there was, unfortunately, any of infection, sorry about that, antibiotics for infection. If there was any, unfortunately, it can happen, any complications in theatre. So, for example, the bladder was damaged and we've stitched it. We've repaired the bladder rather. Then there are other things we will do. We will keep you on drainage of the bladder for 10 to 14 days. So the doctors will explain to you. But largely, we explain to you before we go into theatre what to expect, what complications can arise. It's called informed consent. It's very detailed. And the patient will sign saying, I know I'm going to theatre, my doctor is so-and-so, he's explained to me that this and this and this can happen. However, if this happens, these are the mitigating things he'll do. Like that. Importantly also, when we go to remove fibroids, because I mentioned that fibroids can bleed, although largely there are things we do to stop it from bleeding. There's that one odd case where the bleeding can be so torrential and life-threatening, we have to remove the uterus. So that means when I'm taking consent, informed consent, to remove fibroids, I must explain to the lady that there's that rare 1 in a million chance that I have to remove your uterus to save your life. Do you give me the go-ahead to do so? It's important. And she signed. It's rare. Thankfully, I've, in the years I've been a doctor, it's never happened, never got into that because of modern techniques and good preparation. But it's good to inform. Let your client, let the patient know everything. We don't hide anything from patients.
All right. So what advice would you give a patient who wants to know, select the best treatment option for fibroids?
You can read up to get knowledgeable.
Okay.
That doesn't mean that you're a doctor. In as much as somebody who reads about flying a plane can fly a Boeing 747 from JKA to Heathrow or Gatwick. It won't. Just because you know doesn't mean you can do. Listen to your doctors. And I'd say this, choose a doctor that you can actually trust. I often find, and I've heard cases where patients will argue with the doctor. Then why did you go and choose him? You got to choose someone. Are you the doctor? No. Choose a doctor who you can trust. And when they tell you, let's go this way, they've explained it to you, and it's logical. You can have a second opinion if you want, and if it matches, go ahead.
All right. And how long does a woman have to wait after the fibroid treatment before trying to conceive?
That's good. The uterus will primarily heal pretty quickly, but maximum strength happens after 6 to 8 months. So after 8 months or a year, she can decide to get pregnant. But there are those who get pregnant within 3-4 months, and it's not the best, but we will still do a cesarean section to deliver that child. But certainly after 8 months, you're good to go.
Okay. All right. I think there's one more question that I wanted to ask in regards to, I know of a particular case of a lady who has had multiple fibroid surgery in just a close space of time, back to back. So in such scenarios, do you guys recommend hysterectomy to just remove the uterus, or in such scenarios what happens? Or they just...
So she's an aggressive fibroid grower.
Okay.
We remove them, and then again, many are growing pretty quickly. So maybe in 2 years or 3 years, she's had 2 or 3 surgeries, something like that. That's a difficult one. Thankfully, they're not as common.
Okay. There
has to be a candid talk with her about what she wants. So it will be dependent on one thing. Where is she at in terms of having children?
Okay.
That's the first thing I'll ask her. And based on that, we will know where do we go. Are we going to remove the uterus or keep it, have your children, and we remove it? Sometimes you might find we do what is called a cesarean hysterectomy. She's had her children. When we do the cesarean section, get the baby out, then remove the uterus.
Okay.
So
interesting.
Baby, fine, cure.
Yeah.
Out.
Finally, I have to end this conversation by asking, what about the herbal treatments that a lot of women explore when it comes to trying to treat fibroids?
You mean arorwet?
Well, yeah, all those.
Thankfully, it's not copyrighted, so I can mention it.
Yes.
I'll be honest, I've never seen them to work very well. Drugs, the ones that medically that we use as medical doctors, have gone through the rigorous scrutiny of what we call randomized controlled trials, so we know there is concrete evidence that they work. Oftentimes, herbs might anecdotally, individually, do something. After all, drugs also come from plant sources and everything. But do we know what's the dose? What are the long-term side effects? Do we know? Maybe not. So much as they might be seen to work, that's okay. I would say that's a basis on which we can do studies to see what's there. But my own take, this is me, Dr. Wasuna, I'd rather go with what is tested and tried and true, and we know what it can do. Just because it's herbal doesn't mean it doesn't have side effects. It's just that we don't know them because it hasn't been studied and published. Drugs many of them come from plants or chemicals from plants. It's just that we have purified it and we use it in a certain way, and we are being honest in reporting to you the series of mishaps or etc. that can happen because we have observed them. So a lot of herbs are not. I'll give you case in point. Sometime, maybe 10 years or more ago, there was a certain pill that came from a certain part of the world where it's used for birth control, and you just have to take 1 pill per month. And it was said to be herbal. My goodness, it was not herbal. And it was published, it's in the open domain. The government of Kenya, through the Ministry of Health, gave a warning not to take it because it was actually just a high dose of hormone. So do we know what we are taking?
All right. And I know part of the reason why a lot of women opt for the herbal medication is because majority of the time, most of them don't want to opt for an open surgery. So I think just to land this conversation, we've said that indeed there are other treatment options that don't necessarily have to be open surgery, to be precise.
And it depends on how the fibroids are.
Depending on how the fibroids are.
There are women for whom we will recommend and say no. In fact, I would say no to open surgery. No, it's not for you.
Yeah.
There are those who are, maybe we are borderline, and there are those who are, this is the only way.
It's compulsory. It's the
so everyone is different,
and
we will choose with you, not for you.
All right. Thank you so much, Dr. Harry.
You're most welcome.
All right, that's it for today's conversation. I hope today's information or conversation has been able to equip you with the right knowledge that you need, whether you know somebody who's battling fibroids and they are seeking to explore a treatment option. I hope today's conversation has been able to give a bit of knowledge in terms of how to carry on the conversation with your doctor, but most importantly, seek your doctor based off on the symptoms that you have, or where your fibroids are, or the numbers or the size. Seek the advice of your doctor to be able to know which treatment option is best for you. That's it for today's conversation. Looking forward to seeing you in our next conversation. Bye.